Let's talk more about the latest developments with Gavin Macgregor-Skinner, an expert on infectious diseases, assistant professor in the Department of Public Health Sciences at Penn State Hershey. Doctor, thanks so much for being with us. The president, 2 days in a row, cleared his agenda so he could concentrate on Ebola only. Congress honed in on the public officials who are supposed to be manning the government's response, and Washington seems both concerned and a little bit angry about the response so far. Should it be?
I think, Jonathan, it's very unclear at the moment here in the US who is managing the event. And again, it's not just the patient care we're talking about, it's the whole systems approach that's needed to ensure that we ensure that the Ebola virus is not a risk to anyone within the hospitals or the community. And we're not sure who's managing this event.
Now, you talk about the risk to people inside of the hospitals. We have the specter of a nurse. Her name is Nina Pham, one of two nurses at Dallas Presbyterian who was infected. Today, Dallas Presbyterian essentially surrendered her care, I guess it was yesterday, to another hospital. So, Dallas Presbyterian lost the life, or watched as a man died of Ebola. Two nurses who were handling his care have gotten Ebola. They've been transferred out of that hospital. The nurses who still work in the hospital are speaking out through their union, saying they weren't properly prepared. Now we're told that patients are abandoning the hospital. The hospital is 2/3 empty. It's losing money as a result. That hospital has become the focus for a lot of anger. Does it deserve it? Does it tell us something about other hospitals, perhaps?
No, I think we have to go back to the Ebola virus disease. This disease has no vaccine, no cure, and well over 70% of the people that get this disease are dying from this disease. So, again, no matter what we do when we bring patients into our healthcare system, we treat them with supportive care, but there's a high likelihood they could die. My heart goes out to the nurses and the hospital staff in Dallas. Who's providing the coping mechanisms, the counselling for them at the moment? Where's the communication plan from that hospital throughout the whole US healthcare system and the US public to say, look, this is what was happening in Dallas, this is where the lessons learned are, so we can apply that to the rest of the hospitals in the country, and we haven't seen any lessons learned come out of Dallas yet.
Okay, another question about a non-medical response. Frontier Airlines flew one of those two patients before she was truly symptomatic. Having discovered that, they have grounded all of the flight staff. The pilot who was in the cockpit the whole time, he's not going anywhere. They have grounded the plane. They have cleaned out the plane a number of times. They've actually removed portions of the planes, the carpet, the seating, where that nurse sat. Once again, these are not doctors making these decisions. These are airline people. Are they overreacting? And is it, again, because of the lack of leadership you're talking about?
In the US, I work in many, many hospitals with the Elizabeth R. Griffin Foundation. My team goes into any facility or any, such as this aircraft, and we do risk assessments. We look at what was the symptoms of the person, the patient that was on that plane. We look at what were the hazards identified, and then we look at what do we need to protect. And we, again, it's been clearly stated by the CDC director, we know how to kill this virus. We know this virus doesn't last in the environment for days, it's more like hours. We know the disinfectant, we know the decontamination methods we need to use. So again, go in there, do the risk assessment, use evidence-based approaches, and let's get the Frontier flight plane back up into the air so they can make money. And again, we're not taking a whole community approach as we saw in Nigeria and other countries, and this is really disappointing.